Hello, I'm Dr. Coral Westaway, Clinical Psychologist. I want to think with you today about my profession, clinical psychology, and a bit about how I work as an integrative practitioner. So, what clinical psychologist means in the UK is that we have trained to doctoral level. The clinical bit of psychology means the clinical application of psychology, so working with people around mental health issues in a clinical setting. So that might be in a doctor's surgery, it might be in a community setting, it might be in an inpatient unit, might be in a prison or a hospital, any number of settings. But we've done an undergraduate degree, 3 years, first degree in psychology, and then we've gone away and done more training and experience, and then we've done a 3-year doctorate degree, which involves training and clinical placements. So placements with people across the lifespan, children, young people, families, adults, older adults, people with differing needs, and that we are normally trained in multiple modalities. So I first trained after my first degree in psychology as a person-centred counsellor, which means 3 years training as a counsellor, 200 hours of experience, and that's my real foundation. That really taught me about the relationship, being present with someone, bringing unconditional positive regard, empathy, deep care and curiosity in a relationship, and also working through my own stuff so I can be present with somebody else. I have trained in a number of trauma-focused modalities, trauma processing modalities, so I really think of myself as a trauma-focused therapist, which means I recognise the impact early life and early life difficulties has on all of us, how it shapes our view of ourselves, our world, our relationships with other people, and how our early life really gives us a template of how we are in the world. And when we have difficulties in our early life, that we all do to some degree or another, that follows us through into later life and plays out in patterns and ways of relating and difficulties that keep showing up. So working with early life experiences can really help clear that out from our system, so we're able to show up now and respond to what's going on in the moment without it being loaded by all the stuff from the past. I'm trained in energy psychotherapy, which is an integration of talking therapies, Western talking therapies, and more kind of Eastern wisdom, drawing on meridians, chakras, energy work to bring more than talking to therapy, and really clear all blocks from our energetic system. I also integrate a lot of body work into my work that I do, bringing in awareness of what we're holding where in our body, and really using sound, breath and movement to release and clear that through. I use a lot of parts work, and I will think with you further about different models of parts work, but I draw on a great model called internal family systems that recognises all of us have multiple parts, and they're not always working in harmony. So sometimes part of us might want to do this, part of us might want to do something totally different, and we can feel we're being pulled in different directions. It also recognises that all of our younger selves stay with us as different parts inside of us, and that they carry a lot of those old difficulties from the past. And by working with them to unburden those old difficulties and allow them to feel safe and heard and validated, can really help us move forward. So these are some of the models and some of the ways that I work, and I'm going to do little videos going into more depth on each of these areas. If there's anything else you want to know, please drop me a comment in the messages, and I'll do a video. Many thanks. All the best. Bye.